Hello, my name is Conica Williams. I am an LPN to BSN student at Indiana State University. For my Nursing 444 Community Health course, I will be discussing Human Immunodeficiency Virus, or HIV. Population at risk. Gay and bisexual men of all races are at the greatest risk of contracting HIV. Representing only 2% of the nation's population, men who have sex with men account for 61% of all new infections. Before moving forward with the presentation, please take a moment to pause the video and follow the link below to take the pre-test. Now that you've completed the pre-test, let's go over the learning objectives. After watching this presentation, you will be able to identify the population at risk for contracting HIV, define HIV, apply the concepts learned to address the growing issue, and identify preventative methods. What is HIV? HIV stands for Human Immunodeficiency Virus. HIV is transmitted via contact between broken skin, wounds, or mucous membranes and involves bodily fluids such as semen, vaginal fluids, breast milk, or blood. HIV functions by destroying T cells. T cells are involved in immunity. As mentioned earlier, gay and bisexual men are the population at risk. Pictured here is a graph provided by the CDC that shows the prevalence of HIV in gay and bisexual men. Note that African American or Black and Hispanic or Latino individuals account for a majority of all cases up until the age of about 35 years old. Signs and symptoms. Some individuals may experience 2 to 4 weeks of cold or flu-like symptoms upon infection. It is important to remember that there are no definite signs or symptoms of HIV. The only definitive way of knowing one's status is to be tested. Primary prevention. One type of primary prevention is a sexual practices assessment. This assessment determines whether or not a person is engaging in risky sexual behaviors and needs further teaching on protecting themselves. Another preventative method is syringe sharing risk reduction for people who inject drugs. Reduction is done by ceasing drug use, disposing of needles after use, or refraining from sharing needles altogether. Lastly is pre-exposure prophylaxis, or PrEP. PrEP is a drug that prevents HIV from infecting its host. Next are secondary preventative methods. Getting tested gives an individual insight on their next approach. If positive, the next task is seeking the attention of a healthcare professional. Medications known as antiretroviral drugs may be prescribed and is listed as the next preventative method. Many practitioners utilize combination therapy and prescribe multiple types of antiretroviral drugs due to the rapid rate at which HIV replicates and mutates. Antiretroviral medications include nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, entry inhibitors, and integrase inhibitors. Lastly, are tertiary preventative methods. The goal of tertiary preventions for individuals infected with HIV is maintaining or improving quality of life and preventing the spread of disease. Taking medications as prescribed keeps viral load low. Keeping viral load low helps maintain a fairly healthy immune system and has been shown in other studies to prevent the spread of HIV. Next is substance abuse therapy. Substance abuse therapy for injection drug users maintains quality of life because drug abuse presents with its own set of health issues. Ceasing drug use decreases the risk of acquiring other underlying illnesses and also prevents the spread of HIV through needle sharing. Evidence-based practice. While conducting research for this project, I came across an article that addressed communication among bisexual individuals infected with HIV, entitled My Sexuality, It Creates a Stress, HIV-related communication among bisexual Black and Latino men, New York City. During this study, data was collected from Brothers Reaching Out to Talk About HIV Awareness, or Project Brother. Project Brother explored interpersonal communications about HIV prevention and HIV testing among men who had sex with men who identified themselves as Black or Hispanic and their social networks. What was found is that understanding the communication patterns among bisexual men will contribute to strengthened HIV prevention strategies for bisexual men of color who are disproportionately affected by HIV in the United States. Now that you've completed the presentation, please take a moment to complete the post-test by following the link below. Thank you for taking time to view my presentation. Pictured here are a copy of my references.